Because Oregonians are masking up and continuing to get vaccinated, we have been able to cut the projected length of this surge. That is really good news.
First at 5 o'clock, a positive development, you could say, in Oregon's fight against coronavirus. Governor Brown announcing this morning that the state appears to be slowing the spread of the Delta variant.
And that is good news, but state and health officials do warn people must stay vigilant and not let their guard down against the virus. Pat Doris reports tonight.
The Pendleton Roundup, held September 11th through the 18th, is a huge deal for Eastern Oregon. As many as 50,000 people attend. Governor Kate Brown is usually one of those people, but with the Delta variant still raging in Oregon, the governor will stay home this year.
Unfortunately, Pat, you know I adore attending the Pendleton Roundup, and unfortunately, I will not be going this year. For those who are attending, I encourage them to get vaccinated ahead of time and to wear their masks.
When I asked why she was not going, Governor Brown was clear.
I am certainly concerned about community spread.
Hospitals around Oregon are still overwhelmed by the number of very sick COVID patients, most not vaccinated. The state epidemiologist, Dr. Dean Seidlinger, said the number of new cases for the most recent week available totals more than 16,000, which is 13 times higher than the total for the week ending the 4th of July, which was just over 2 months ago. But there is good news. Researchers believe the virus is spreading a bit slower than before. Dr. Seidlinger said mask wearing and vaccinations help a lot.
The decisions we make over the next few weeks will determine whether we plunge deeper into the crisis of care or we reverse this rising tsunami.
The number of cases is likely to stay high for most of September.
So I'd anticipate, if our current trend and the modeling holds, that we will see those decreases by October. But we can't rest on our laurels. This is not an on-off switch. It's a dimmer switch.
With hundreds of thousands of Oregon school kids returning to classrooms, the Department of Education put out 5 advisories for schools and families. They include all eligible youth and adults who come in contact with school-aged children should get vaccinated. Families with school-aged children and teachers should limit gatherings and activities with people outside their household. Schools should reduce extracurricular activities and hold meals, recess, PE, and other classes outside if possible. Schools should also hold beginning of the year activities like Meet the Teacher Night online, not in person. Finally, families should check their school's website to read the plan for safely returning to classrooms. School leaders say there have been lots of safety precautions taken and there's lots of testing available to make sure the return to in-person class is safe this fall. We'll be watching closely over the next couple of weeks to see how that actually works out. In Northeast Portland, Pat Doris, KGW News.
A number of sports teams in Washington have announced new COVID vaccine policies. Fans, for instance, will need to bring proof of vaccination to Seattle Seahawks, Sounders, and Kraken games, as well as Washington State and Washington college football games. This applies to fans 12 years old and older. Those who aren't vaccinated can alternatively bring a negative COVID test taken within 72 hours of game time. The same policy is already in effect at Providence Park and Oregon State athletic events.
At the same time, outdoor mask mandates are slowly coming to Washington, too. Today, new mask rules started in King and Pierce counties in the Seattle and Tacoma areas. All people 5 years and older, regardless of vaccination status, must wear masks at large outdoor events. And that's defined as 500 people or more attending. Oregon already has a similar outdoor mask policy statewide.
In North Idaho, crisis standards of care are now in effect. That's because of a surge in COVID patients and a severe shortage of hospital staff and available beds. It basically means that they're starting to ration health care. In the most severe examples, care may be prioritized for patients most likely to survive. That means a COVID patient who needs a ventilator may not be able to get one, or somebody badly hurt in a car accident may not get a hospital bed, and someone who is near death may only receive what they call comfort care, as hospital staff focus on other patients with better odds. North Idaho has some of the state's lowest rates of COVID vaccinations. State officials there say 95% of their COVID patients are unvaccinated. The crisis standards are only in effect in North Idaho right now, but doctors warn they could become statewide if current infection rates continue.
With just a few weeks before classes start back up, Clackamas County held a vaccine clinic today at Clackamas Community College. Devin Haskins caught up with those getting vaccinated.
This is the first of 2 vaccine clinics here at Clackamas Community College. This one closes at 6 tonight. Not only are people here getting the shots, they're also getting some incentives to go along with it.
When the doors opened, there was a steady stream of people coming in to get their first or second dose of the COVID-19 vaccine. The clinic is open to those 12 and older. They had a choice between the Pfizer or Johnson & Johnson vaccine. Each person was not only given a $50 gift card from the county, but something a little extra from the college.
We are offering tuition waivers that are worth $444, so it's one free class that you can take at any time within the next year, and we're also offering $50 gift cards to our bookstore.
Just over 70% of the county over the age of 18 are vaccinated in Clackamas County. The state has set a goal to hit 80% of adults. It's taken Josefa Salguero Wilkes 5 months to convince herself to take it.
I'm still afraid of it, but I feel like with the Delta or whatever skull and all the others that are going to prop up, I think it's less dangerous to take the vaccine than not to take it. So after many months of thinking about it, I just felt like it is a better choice to do it.
The next vaccine clinic here at the college won't happen until September 28th, and it'll be open to everyone ages 12 and over. In Oregon City, I'm Devin Haskins, KGW News.
It's been 18 months now since the pandemic began. Small businesses, though, still struggling to make ends meet. You can drive around Portland. You can see the incentives being offered in front of these businesses, asking people to come back. You see line cooks, $1,000 there, but it's still not working. We spoke to a manager of a small coffee shop in North Portland who says the majority of his sales are from coffee beans, and he rarely sees his old customers gather inside or outside of his shop. There's also a widespread labor shortage across multiple sectors, especially the restaurant industry.
It used to be a very active space where people would be sitting all over the bar and hanging out and talking, and nowadays it's usually just me with a couple of people filtering in and out.
That's Mark Joseph there, and he says how they're running right now is just not sustainable in his opinion, and isn't sure how long that he can continue to work 10-hour days.
We talk a lot about blood shortages, and this time is even more serious. Blood donations are needed for some patients to survive, but it turns out many people are not eligible to give. And during the pandemic, it's an extra challenge. Galen Etlin looks at what's being done to save lives.
Dr. David Glidden at Legacy Emmanuel in Portland says the situation is dire.
This is the worst of the worst.
Blood donations are down everywhere. To his patients,
A life and death situation for some. Most certainly.
When it feels like it's getting better, it really isn't.
Angel Montez with the Red Cross says donations have been down most of the pandemic, especially with companies and colleges operating remotely. Now with COVID Delta concerns.
Will they be able to host blood drives on site, or will they not?
We're in a tough spot right now.
Vicki Finson with Bloodworks Northwest says this summer's big drop is a problem with blood's short shelf life.
How does this one compare, would you say?
One of the worst and prolonged shortages that I've seen in my entire blood banking career.
Bloodworks Northwest is taking appointments and hosting pop-up events like this one at McMinimans Edgefield.
I might have died if I hadn't had the blood transfusion.
It's also producing promotional clips like this in Seattle with radio host Cheryl Waters, who now donates blood after surviving cancer treatment.
When I needed it, it was there.
You are on the front lines. What is that like for you and your patients right now? Very, very challenging. We are actually still able to provide blood truly when needed, but what we're living with now is really a complete elimination of a cushion that we have been accustomed to for so long.
You're really having to budget the blood in that sense.
That is correct.
That means there's enough blood for emergencies, but providers are making tough choices to hold off on other surgeries.
There are people who really, really need it.
Dr. Kirsten Alcorn with Bloodworks Northwest helps track eligibility. The Red Cross estimates only about 40% of Americans can donate. But during the pandemic, the FDA temporarily reduced restrictions from the 80s on gay and bisexual men, allowing them to donate if they have not had sexual contact within 3 months.
Was not causing decreased safety.
Where do we go from here to make it easier for people?
We would not like to unnecessarily exclude anybody. We have to use safety as our guiding factor.
This is a community issue.
Dr. Glidden says people should reach out to see if they can donate as the need grows.
We expect this shortage to last on the order of months.
Galen Etlin, KGW News.
Tonight on NBC News, Lester Holt is at ground zero with the first fire chief who went inside the World Trade Center on 9/11. Retired Chief Joe Pfeiffer walks Lester through that day, including the loss of his brother, who is also a firefighter. Chief Pfeiffer will share what he saw and what it feels like to return to the site now.
We heard this loud noise of a plane coming overhead, and then I watched this plane flying at a low altitude race past us.
Plane's going this way.
Going along the Hudson River at a very, very fast speed, and so low I could read on the fuselage the word American. And then I saw the plane aim and crash into the World Trade Center.
This is part of Nightly's week-long series, America Remembers, looking back on the 9/11 attacks 20 years ago. You can watch the reports on Nightly News beginning at 5:30.